This lecture will go over multiple sclerosis, which is on page 271 of the chapter 21 in the Farm Book. Multiple sclerosis is an autoimmune disorder that attacks the myelin sheath of nerve fibers in the brain and the spinal cord, which results in lesions called plaques. So when I think of multiple sclerosis, a lot of times you hear it called MS, and I remember myelin sheaths also begin with MS, as that being where the problem is for multiple sclerosis. So it's the body's own immune system attacking the myelin sheath, which are basically, you could compare it to insulation around electrical wires that helps conduct the messages. So when that myelin sheath gets destroyed, the nerve impulses can't travel like they should. Common manifestations of MS are motor, sensory, neurologic, cerebellar, and emotional problems. Motor symptoms include weakness or paralysis of limbs, muscle spasticity, and diplopia. Patients with MS experience sensory abnormalities, including numbness and tingling, blurred vision, vertigo, and tinnitus. Patients may experience neuropathic pain, particularly in the lower thoracic and abdominal areas. Cerebellar signs include nystagmus, ataxia, dysarthria, and dysphagia. Many patients experience severe fatigue. If sclerotic plaque is located in the central nervous system, problems with bowel and bladder function and sexual and cognitive dysfunction occur. MS is difficult to diagnose. Most physicians use at least one other test besides medical history and neurological exams, such as MRI, visual evoked potential testing, or analysis of cerebrospinal fluid to confirm diagnosis. There are different classifications of MS. There's relapsing remitting, with relapse with full recovery and residual deficit. So the patient who has MS, at times you can't tell they have any sort of disease. They feel really good, and then they have exacerbations or flare-ups. And then when they recover fully or almost completely after those flare-ups. Primary progressive, slowly worsening neurologic function with relapses or remissions. Secondary progressive, initial course is relapsing remitting, and then progression with or without occasional relapses, minor remissions, or plateaus. And then finally, progressive relapsing, progressive from onset with acute relapses with or without full recovery. Here's a list that contains drugs used to treat multiple sclerosis. Again, multiple sclerosis is an autoimmune disorder, so it makes sense that some of these treatments are treatments that affect the patient's immunity. So the first one listed is immunomodulators. They are disease-modifying drugs that can slow the progression of a disease and prevent relapse. Your prototype MS drug on page 272 is beta interferon, which is an immunomodulator. When you're looking at the side effects listed for beta interferon, one of the side effects that sticks out to me is neutropenia, because if you're thinking about a medication that's affecting the patient's immunity, we want to be watching labs and watching what the patient's own white blood cells are doing. Another classification used to treat multiple sclerosis is immunosuppressants. Mitoxantrone is the first one listed as an immunosuppressant on page 273, if you can recognize that name as an immunosuppressive. I'd also like for you to know alemtuzumab, which is a monoclonal antibody. So that's on 273 under monoclonal antibody. A lot of times those monoclonal antibodies end in the ending MAB. So alemtuzumab is a monoclonal antibody. It targets the part of the immune system that is thought to be harming people with MS. So it's a medication that finds what's harming that immune system and tones it down or prevents it from working. Finally, corticosteroids, enenzoin or Solone, they're used to manage exacerbations of MS. So usually not a daily treatment, but let's say I have an exacerbation that's really troubling me. I go to the ER, likely I will get some IV steroids to help manage that exacerbation. They work by reducing edema and acute inflammation at the site of demyelination. Next, we're going to talk about skeletal muscle relaxants. Again, the patient with multiple sclerosis can experience spasticity. So we're going to move along. We talked about the medications that can affect the immune system. Now we're going to talk about some medications that they can take to treat that spasticity of the muscles. Muscle relaxants relieve muscle spasms and pain associated with traumatic injuries and spasticity from chronic debilitating disorders such as MS, stroke, cerebral palsy, head and spinal cord injuries. Centrally acting muscle relaxants relieve muscle spasm and spasticity and have a sedative effect. Your prototype drug on page 275 is a central acting muscle relaxant, cyclobenzaprine. Cyclobenzaprine works by relieving muscle spasm and by relaxing skeletal muscles. Side effects include anticholinergic effects. You guys should be familiar with those: blurred vision, dry mouth, tachycardia, urine retention, constipation. Also include drowsiness, dizziness, headache, GI distress, unpleasant taste, and dysrhythmias. On your need to know med list, I also listed some other medications from 274. Again, I just want you to recognize those generic names and recognize that they're muscle relaxants. Pancuronium is one that's sort of different from the others. It's a neuromuscular blocking agent. It can be used with anesthesia, so it's more of a paralytic. So if you see that C-U-R-O-N-I-U-M, coronium, whether it's vecuronium or pancuronium, you should be thinking that that's a paralytic. So let's move on to your nursing process box. This box is on 275. It's over cyclobenzaprine, the central acting muscle relaxant. Go ahead and pause the video and pull out what you think is most important. So under assessment, we want a medical history, a drug history. We want to know if the patient has glaucoma. Again, the side effects are anticholinergic side effects. And if you think of the two things that you just have to remember for anticholinergic side effects, it's drying and no glaucoma. And again, the no glaucoma, is that because it's causing miosis or mydriasis? It's an anticholinergic and it's causing mydriasis, which is bad for glaucoma. Assess the patient's health history to identify the cause of the muscle spasm, determine if it's acute or chronic. Nursing diagnosis, physical mobility, impaired physical mobility would be the issue there. Under planning, we'd expect the patient to be free from muscular pain within a week. Want to monitor liver function tests, record vital signs, look for any abnormal signs, and note any CNS side effects such as dizziness. For patient teaching, teach the patient that the muscle relaxant should not be abruptly stopped. The drug needs to be tapered over a week to avoid rebound spasms. So that's a big important thing that we need to teach our patients. They should not abruptly stop taking it. Advise patients not to drive or operate dangerous machinery or make important life-changing decisions when taking muscle relaxants. They do have a sedative effect that can cause drowsiness. Inform patients that most of the central acting muscle relaxants for acute spasms are usually taken for no longer than 3 weeks. Teach patients to avoid alcohol and other CNS depressants. Advise patient that these drugs must be used cautiously when pregnant or nursing. They need to follow up with their OB about that. Patients should always check with the healthcare provider prior to stopping the medication. Under side effects, encourage the patient to report side effects of the muscle relaxant: nausea, vomiting, dizziness, fainting, headache, and diplopia. Dizziness and fainting are most likely caused by orthostatic hypotension. So we've got safety issues there. Under diet, advise the patient to take the muscle relaxant with food if they experience GI upset when taking it. So let's go through these post-PowerPoint questions, read through it, and see if you can get the right answer. Go ahead and pause it as you read through it. If you picked the answer D, neostigmine, that is the correct answer. So in the question, the patient's already been diagnosed with myasthenic crisis. So they come in, we're not sure what's going on. We give them the edrophonium to figure out if it's myasthenic or cholinergic crisis. We find out it's myasthenic crisis. What do we treat them with? We then treat them with neostigmine, which is a short-acting acetylcholinesterase inhibitor. Question 2. For question 2, if you answered A, atropine, that is the correct answer. Question 3. Question 3, if you answered C, edrophonium, that is the correct answer. Again, we're trying to decide which crisis it is, what's going on. Edrophonium is the drug used to determine that. Question 4. Correct answer is A, improved muscle strength indicates that neostigmine therapy is exerting a therapeutic effect. Question 5. If you answered B, that's the correct answer. Suppression of the immune system and risk for infection are two of the main side effects associated with high-dose corticosteroid therapy. And finally, question 6. Baclofen is one of the medications on your need-to-know list. The correct answer is C. Muscle relaxants are used to decrease the patient's muscular pain and spasticity.